In the midst of a 14-day state-mandated shutdown of all non-essential businesses, the city of Presque, Maine has become desolate, with only grocery stores, auto parts stores, and a few other essential businesses allowed to remain open during the so-called COVID-19 coronavirus pandemic. What seems to be lost in the COVID-19 noise is the fact that as of March 7th, 2020, the CDC estimates there have been 45 million conventional flu illnesses in the U.S. so far this year, with 300,000 hospitalized and over 46,000 deaths. Contrast that with the 177,000 verified COVID-19 cases across the U.S. and its death rate of only around 3,400 as of March 30th. Maine had a lackluster showing on the national COVID-19 scoreboard in the opening quarter of the game. At the end of March, 4 counties out of the 16 in Maine didn't even have a confirmed COVID-19 case. There were only around 235 active, confirmed cases of COVID-19 in the entire state, after subtracting out those who were confirmed to have the virus but had fully recovered. Over 3,800 tests for COVID-19 came back as negative. One of the primary strategies to prevent the spread of the virus was to shut down all schools and businesses and keep everyone home. In an op-ed on nationalpost.com, Stanford University professor of medicine and professor of epidemiology and public health, John P. A. Ioannidis, points out the problems of using insufficient data with school closures due to COVID-19. Professor Ioannidis writes, "In the absence of data, prepare for the worst reasoning leads to extreme measures of social distancing and lockdowns. Unfortunately, we do not know if these measures work. School closures, for example, may reduce transmission rates, but they may backfire if children socialize anyhow. If school closure leads to children to spend more time with susceptible elderly family members, if children at home disrupt their parents' ability to work, and more. School closures may also diminish the chances of developing a herd immunity in an age group that is spared serious disease." In addition to a healthy dose of mainstream media hype, government officials likely read a report from Imperial College in London, headed up by Neil M. Ferguson. In the report, entitled "Impact of Non-Pharmaceutical Interventions to Reduce COVID-19 Mortality and Healthcare Demand," the authors used computer models to wargame a virtual scenario that showed COVID-19 ramping up in the U.S. around mid-April and death rates estimated at 510,000 in the UK and 2.2 million in the US. Those figures have proven, with current death statistics, to be wildly exaggerated. Deaths attributed to COVID-19 are primarily among people who were already suffering long-term medical issues such as cancer, COPD, emphysema, etc., which may have been the actual cause of death. This is how the numbers are being gamed to support lockdown of society. This numbers skewing tactic was confirmed for Maine by Dr. Nirav Shah, director of the Maine CDC. In a webcast press conference on March 31st, Dr. Shah said, up to this point, they had been prioritizing tests on the, quote, highest risk individuals and have been holding on to the samples from the, quote, lower risk individuals.
These are samples that had been waiting testing at our laboratory, but because of our focus on the highest risk individuals, had not yet been tested. Maine CDC has been looking at this problem from both ends. One way is to use some of our testing capacity to shrink this number to as small as possible. So as of right now, that number stands at 600 tests. These represent individuals who were in the lowest risk category. As of right now, for individuals in the highest risk categories, that is to say, individuals who may be hospitalized, individuals who are healthcare workers, or folks from congregate settings, there is no backlog of tests at the Maine State Laboratory here in Augusta.
When factoring in all of the people who actually have or have had the COVID-19 virus, which may be impossible data to obtain at this point, and considering most of them do survive, the death rate could plummet to well below 1%. Some estimates put it as low as 0.45%. Hospitalization rates in Maine were also low. Out of the first 150 or so verified cases in Maine, only 22 people were in bad enough shape to require hospitalization. The rest of them simply rode out the virus and recovered while quarantined at home. These stories and more in the print edition of the Fort Fairfield Journal. For WFFJ-TV, I'm Dave DeShan.